As James touched on, mental health illness is something that is really not discussed much in the medical community, neither here in Canada, around the world, or in North America. It's important to have advocates who go out there and open the world's eyes, as I talked about yesterday, to the issues of mental health. And I'm proud to introduce someone who's doing just that. James talked about numbers, the numbers of people. The woman next to me, she's written a book, one book, that is being given to every 8th grade student in Canada about mental health issues. She's gone and spoken at 2 TEDx talks. She's done a total of 600 speeches about mental health issues. But to me, the most impressive number is a number 14. Because 14 represents the number of years since Alicia tried to commit suicide. I'd like to introduce to you Alicia Raimundo.
Worldwide, more people die from suicide than murder and terrorism combined. In Canada, only 1 out of 3 people who need mental health services will get it. Why? Because although more Canadians live with mental health issues than cancer and heart disease combined, we only receive 8% of the funding. I think the first step to improving the lives of people living with mental illness is to remove the stigma. Many people suffer in silence because of the way our societies view mental illness. It's viewed as dangerous, an excuse for bad behavior. 51% of Canadians said that they wouldn't be friends with someone with a mental illness. It's still seen as an awful thing to live with. Let me tell you what this is like from the other side. When I was a young girl, when my peers were happy, I was anxious and depressed. It didn't matter what was happening around me. My feelings were like a gray cloud, and they followed me everywhere. I had no idea why. My parents are amazing. My community is great. I have an education, and I never needed for anything. I tried everything that they tell you. I smiled, thought positive thoughts, exercised, and was thankful for my blessing. None of it helped. I grew increasingly desperate for an answer. Eventually, I talked to my parents and a teacher. My parents told me I was overdramatic and that it was a teenage phase. My teacher told me that I was crazy. I felt confused, isolated, and broken. And it's these thoughts that led me to try to take my own life. When I woke up in the hospital, I was greeted by an older lady. She took my hand and said to me, "From one crazy person to another, you'll need this," and placed a simple silver necklace in my hand. On it was a charm, and the charm read, "Hope." It was this moment that taught me that people with mental illness are human, and the way we talk about mental illness is wrong, because even though she was sick, she gave me the one thing I needed back: hope. In order to change the stigma around mental health in our societies, we need to re-educate people, especially the young. So I wrote Red Carnation, a book on my story that's part of the national curriculum. Now kids talk about depression in their classes, think critically about mental illness. Parents from across Canada are sending me messages saying that my story helped their kids turn away from suicide and ask for help. One kid, now understanding depression, reached out to a kid in his class and became his first friend. His view of depression has changed forever. I advise the writers of Degrassi, a Canadian drama TV show, some of you might know that as where Drake got his start, about creating a character with depression. Now people will see a character who's depressed, who faces stigma, who asks for help. It's my hope that they will see this role model as a person who can live with depression and still have an amazing life. Thank you. I've spoken to over 100,000 people in person and millions more through national media and radio, things like MTV, CTV, CBC. But what I love the most is the 200 people who send me messages saying that my story and speaking honestly about mental health helped them turn away from suicide and ask for help. Thank you. I know from that talking is not enough, so we built Access Open Minds, a new clinic that will be opening in 13 communities across Canada. It will reduce wait times in these communities from 6 months to 72 hours. It'll take young people like me, give us clinical skills, so that the young people in those communities will get support from somebody who's been there. The first 2 clinics have opened, and the remaining 11 will open before the end of the year. Young people are telling me that they want to make the changes in mental health that their communities need. So we built Be Change. Be Change is a mental health incubator that gives resources, mentorship, and crowdfunding to young people so that they can make the changes that they want to see. So what can you do? Talking about mental health and listening is so important. To the 1 in 5 out of you who are living with a mental illness right now, and the 1 in 20 of you who are feeling suicidal, I see you. I love you. There's amazing life on the other side of how you're feeling right now. For the rest of you, if you're wondering about how to make change in mental health, do this. Close your eyes. Think about the hardest time you've had in your life so far. Think about the person that you needed during those times. Open your eyes. Be that person. Thank you very much.